The national emergency for COVID-19 is officially over. President Joe Biden signed legislation Monday that ended the national emergency. The end comes more than 3 years after it was declared by then-President Donald Trump. The White House publicly opposed the measure, but the president agreed to sign a bipartisan congressional resolution to bring it to a close.
Well, 1 month from today, the U.S. won't be under a public health emergency either for the first time since January of 2020. So what will that mean? Here's Abby Larico to verify.
Over the course of the next month, you may be seeing ads and posts urging you to get your COVID-related treatments like vaccines and at-home tests before they're harder to get. So will access to tests, vaccines, and treatment change after the COVID-19 public health emergency ends on May 11th? We checked with these sources to verify. Let's start with COVID tests. Once the public health emergency ends, access to free at-home tests will end for people with traditional Medicare. Medicare will still pay for tests administered by a doctor, like PCR lab tests, but there could be a cost for the doctor's visit itself. Private insurance and Medicare Advantage will also no longer be required to provide any free testing, be it at home or with a doctor, though some might continue to do so. As for vaccines and antiviral drugs like Paxlovid, access going forward isn't tied to the public health emergency. Instead, it's all about supply. The federal government has a stockpile of vaccines and antivirals. Those federal resources are free to anyone, regardless of insurance status. But numbers are limited, and ongoing access relies on federal funding that Congress hasn't provided.
The main issue will be for people without health insurance.
So for vaccines and antivirals, access will continue in the near term, but unless the government makes new policy, costs might increase once federal supplies run out. So we can verify that yes, access to COVID tests, vaccines, and treatment will change in the near future, but not just because of the public health emergency ending. With your Verify, I'm Abby Larico.